Hey everyone, Prof G here, and today we're going to be talking about diarrhea. And more specifically, we're going to go into some cases to kind of show how a vignette would look for each different type of diarrhea. Now, before I came up with these cases, I was looking online and I just couldn't find any really good resources to help kind of quiz and make sure that I understand how these different types of cases present. So I went ahead and created some really short and brief cases. A lot of them are very pathognomonic, meaning that I put in some of the more important key factors to look out for. Some of it might be, a little too much, kind of giving it away. But I just wanted to show you different cases that you could stack up kind of side by side and try to pick out the most important bits of details that they're sharing with you in order to come up with the right diagnosis. So let's dive in. All right, so these are the cases to help us understand diarrhea. All right, let's move forward. So if you've already done these cases, awesome. If you haven't had a chance to look at these, they're multiple choice format. And if you look down in the description below, there will be a link for you to take this kind of as a practice assessment before we dive into them and break them down one by one. All right, case one. So I'm going to pull out my pen here so that we can kind of dissect it together. Case one, we have a 40-year-old woman. She's coming in with a sudden onset of severe nausea and vomiting, and this started about 6 hours after an outdoor potluck. A very, very specific time frame. Time frame is going to be really important when we're looking at these cases. And it's predominantly vomiting, which is also characteristic of this pathogen. No diarrhea, no fever, no abdominal pain. And others at the party have also had similar symptoms. So it's probably something that they ate. In other vignettes, I would expect to see like an egg salad sandwich or something with mayo left out. So what are you thinking? What is the most likely causative agent? And I'll give you a second to look over the answer choices. All right, well, if you said Staph aureus, you are correct. So Staph aureus has a very short half-life. So it comes on incubation period really quickly. It's probably one of the quickest ones that we have from the foodborne illnesses. It's rapid onset, severe nausea, and more predominantly vomiting. You can get some diarrhea, and if you do, it's usually non-bloody. And it's considered what the typical food poisoning. Other things here like Clostridium, we would think maybe you could get a little bit of diarrhea, but the onset would be later. Salmonella as well, longer incubation period, and norovirus. Whereas you can pass it like in these potluck type things, it doesn't usually mention specific eating venues when we talk about norovirus. It is spread in close quarters though, so it is something to consider, but we tend to see more diarrhea with that. Okay, so that's case one, and this is our patient presenting these egg salad sandwiches. Okay, moving on to case two. So case two, we have a 23-year-old woman. She is presenting with 3 days of fever, cramping, and diarrhea. Okay, that sounds pretty generic. Can't really see much when I read that. Then they mentioned that she ate a salad containing raw eggs, and this was about 4 days ago. So we have kind of an idea of when she might have been exposed to this pathogen. No vomiting, no bloody stools. It's very important. Vital signs, maybe low-grade fever here. Heart rate's a little bit up. So what is the most likely cause? Well, I think in this case, since it's not 100% clear, we need to kind of go one by one and look at them. So I'll give you a chance to kind of come up what you think your right answer is in your head first. All right. So the correct answer is salmonella, and this is kind of how we come to that conclusion. Now, raw eggs is one of the products that salmonella can come from. Other things that I see often are like raw chicken, poultry, unwashed lettuce, spinach. In this case, E-Tech, it didn't mention any recent travel, so usually it's going to mention something like a traveler's diarrhea there. Campylobacter is often linked with poultry. It can present usually a little bit of diarrhea related to it. It's a little harder to differentiate here, but I think given the circumstances, I would have chosen salmonella. And then Shigella usually causes a dysentery, so that's bloody diarrhea. So that's how we came up with the salmonella. All right, moving on. We have case 3. Now, in case 3, we have a 30-year-old HIV positive. They mentioned that right out the bat, okay? He has a week-long severe watery diarrhea, and he swam in a public pool, which is an open water source. No blood and no fever. So no blood, no fever. Vital signs is a little bit tachycardic, otherwise pretty non-specific. So what pathogen? Now, even if we just stuck with the HIV positive thing, one is jumping out the page at me. So I'll give you a second to think about what you think the correct answer is. Good. If you said cryptosporidium is an infection that tends to happen in HIV positive individuals. The fact that he was in a public pool, it could be a contaminated water source. Other things, there you have to look for these special types of infections in immunocompromised patients like HIV patients. The other of these, so Giardia usually cause kind of a greasy stool appearance after hiking, so it doesn't really fit the picture. Norovirus, although patients can get this type of presentation, it's usually more acute onset, it doesn't last quite as long. And then E-Tech, they didn't mention any specific travel, which is what they're usually going to mention in this case. Good, so we're rolling right along. We actually have 17 cases, so please stick with us right to the end, okay? All right, case 4. We have our 30-year-old backpacker, okay? And 10-day history, so a week and a half-ish of smelly, greasy diarrhea, okay? And if you've never seen greasy diarrhea, it's like you don't know what it looks like until you see it. We basically see kind of like oil droplets on the top of the toilet, kind of floating within the water and stool. He did drink some unfiltered stream water on a camping trip. It's been about 2 weeks since that happened. So his vital signs look pretty decent, and it's asking us which pathogen. So of these choices, now if they mentioned it was a backpacking trip like in Mexico, Central America, I might consider E-Tech, but they didn't mention that, so I'm not going to go with that. And then of these, the one that really jumps out the page is Giardia. So Giardia is a little swimming organism. It lives in sources like streams. When patients go camping, they often, they'll drink the water, or they'll swim in the water, and they can present with this. It's usually subacute, can be acute, and they present with this greasy, foul-smelling diarrhea. So that is jumping off the page for that. Okay. All right, case 5. So we have a 35-year-old male. He presents with watery diarrhea, mild abdominal cramps, and he just returned from a trip to Mexico. So could make it a little more obvious, but it's a trip. It's a recent travel, and it's to an area that it has been known to have this type of infection happen. So vital signs look pretty well. His diarrhea is going to be watery, non-bloody, so no blood in the stool, and he has no fever. So he comes back and he has these symptoms. I'm going to think, what? Yeah, probably a traveler's diarrhea, so ETEC, and that's enterotoxigenic E. coli. And very important to differentiate this type of E. coli from the E. coli 0157H7. That's different. It's going to present differently. So this is going to be someone who just came back from traveling. They usually have some diarrhea, non-bloody, and just kind of overall cramping and things. It can be self-limited, meaning it can go away on its own. If it isn't improving, we can prescribe some Cipro, some sort of fluoroquinolone, or in pregnant people or young kiddos, we can do like an azithromycin. Okay. All right, case 6. So we have a 5-year-old child. So now we're getting into some kiddos. 2-day history of abdominal cramping. He has also some fever and bloody diarrhea. Ooh, bloody diarrhea. There is an outbreak of diarrhea at the child's school. So I want you to think about this. but I don't want you to get hung up on it, okay? So keep reading. No vomiting, no significant travel history. He's got a low-grade fever. That's not probably not tachycardic for a 5-year-old. Blood pressure looks about normal too. So I think in our head, if we're used to seeing these buzzwords, if we see a child's school or daycare, we're automatically conditioned to choose rotavirus, right? And it is on our list here. But there's one thing in this history that is pointing me away from that. Can you tell me what you think that might be? Yeah, this bloody diarrhea, bloody, should not be present in rotavirus. Okay, so it's got to be something else. So trying to think what other types of infection can cause these little mini outbreaks, especially in kiddos. And so I look at this list and it's specifically talking about a kid. So I'm thinking, bloody diarrhea, kiddo outbreak within a small school. Didn't mention anything about anything specific it was eating. So it is Shigella. So Shigella can cause bloody diarrhea, fever, and it tends to have these little outbreaks in kiddos. Um, let's see. Rotavirus. So we talked about rotavirus shouldn't have any bloody stools. Norovirus should also not have bloody stools, and it can be kind of in close quarters. It can be little outbreaks, but no bloody stools. Now, E. coli can cause bloody stools, but we usually see this in the setting of eating some sort of product with this type of E. coli, like undercooked beef or things like that. It doesn't mention anything like that in the history, so that wouldn't be my top choice. Shigella would definitely be my top choice here. All right, moving to the next case. We have a 33-year-old coming in with a day-long history of profuse watery diarrhea, and she's also dehydrated. So it mentioned the word profuse. I don't think vignettes take that word very lightly. So let's keep going. Drank some untreated water when she went on a humanitarian trip to India. She's having no fever or abdominal pain. But if we look at her vital signs, she's tachycardic. She's a little hypotensive. And when we look at the stool appears kind of this light-colored, cloudy water appearance. So when we read that, what are you thinking in terms of infection? Give you a second to think about it. Yeah, so if you thought Vibrio cholera, you're correct, okay? So this is another way to describe those rice water stools that patients can get with Vibrio cholera. And these patients get dehydrated really quickly, which is what they're mentioning here up front. Very important to very aggressively rehydrate these patients because they can, in fact, die, not of the infection, but of the sequela from dehydration. And so Vibrio cholera is the correct choice on this one. All right, case 8. So I've been including these little images here. Some of them are relevant, others not so much. This one's pretty relevant because it's not the image is not discolored. This is the patient's actual color. So that's going to be an important factor as we read through this. So we have a 28-year-old, week-long history, has this fatigue, kind of low-grade fever, dark-colored urine, and traveled to a country with poor sanitation. Could be anywhere, right? Mild jaundice, and also some icterus I can see on here. So the yellowing of the eyes, yellow color of the skin. Vital signs look okay. What is the most likely diagnosis? So of all of the infectious diarrheas that we've discussed, none of them have really mentioned jaundice except for one that I can think of. And we didn't really cover it within the context of infections like GI infections per se, but it is technically an infection. It's just an infection of a different organ, which is the liver, right? So this is an example of acute hepatitis. So this is hepatitis A. Usually they get kind of this flu-like illness, low-grade fever, dark-colored urine. They might have some vague nausea, vomiting, some jaundice. And so none of these other ones make sense because only hepatitis is going to have that jaundice associated. So don't get caught up in this infectious process thinking it has to be one of the other viruses or bacteria. Look at the picture. If it is with jaundice in the description, think hepatitis A. And what is the treatment for this? Well, it's self-limited, so we just use supportive care. There are no specific treatments for hepatitis A. All right. Case 9. 40-year-old man, fever, and bloody diarrhea, abdominal cramping. So still a little non-specific, but we know it's one of the inflammatory type diarrheas because we have bloody diarrhea. They ate some undercooked chicken, so I'm thinking, which ones of my pathogens can be an undercooked chicken? Okay, let's keep reading. Later, he has this tingling in his feet and weakness in the lower legs that's ascending up. Okay. That sounds like something that we might have touched on in the neuromodule. So let's keep reading. Decreased reflexes. Vital signs has a fever, looks like. And heart rate is a little upper limit, normal, otherwise nothing specific there. So which of these pathogens can cause this neurologic type presentation? I'll give you a second to think. Great. If you said Campylobacter, you are correct. So Campylobacter is often associated with undercooked poultry, and it can cause GI symptoms. And rarely, although things that are rare in the real world are often not so rare in the testing world, right? Because we need to discriminate. We need to give you something to hang your hat on, say, I know that this is Campylobacter. They put in here a complication, this sentence here, that kind of sounds like a Guillain-Barré. And so when we see that, we should think Campylobacter. And none of these other infections tend to cause that type of neurological finding. So be familiar with Campylobacter and it's associated with Guillain-Barré. Very good. Continuing. All right, case 10, 10-year-old, bloody diarrhea, abdominal pain after an undercooked hamburger. Okay, that one's starting to sound familiar. Also has these kind of other random symptoms that you don't often see with GI bugs. So she has pallor, she has reduced urine output, and anemia. She also has an elevated creatinine. So I see kind of a few things here that look out of the ordinary for the typical GI bug that we see, and starting to make me put the two pieces together between the undercooked hamburger and these symptoms here. Vital signs looks pretty good. But she looks sick. She's in the hospital, okay? So what is the most common causative organism? I'll give you a second to think. All right, if you said E. coli 0157H7, you are correct. Now, if you didn't have these multiple choice answers, you could just look through this and you can pick out the undercooked hamburger consumption. And then you have these three things. We have this anemia present, so pallor, anemia kind of go together. We have this reduced urine output or elevated creatinine. Those two things go together, which show you impaired renal function. And then we can also maybe see some thrombocytopenia, which they didn't mention, but you don't have to mention all three to know. This is talking about hemolytic uremic syndrome. Okay, HUS, although it's not always coming about from E. coli infection, it is a life-threatening manifestation of patients that have E. coli. So it's very, very serious for these kiddos. Now, none of these other ones make sense for this. This causes like a Guillain-Barré. This one is in HIV patients. And this one doesn't really cause much of anything, just some diarrhea in close quarters. So hopefully when you're reading your vignettes, you're looking at a kiddo, you see these extra manifestations of HUS and you can put those pieces together. All right, we're more than halfway done here. We are on next case, case 11. We have a 3-year-old boy. He looks kind of sad. Doesn't look like he feels very well. And this kind of looks like a school or daycare setting. So we have low-grade fever, vomiting, watery, foul-smelling, greenish, yellow diarrhea. Okay, if I just stop reading right there, I can think common things are common and I'm already thinking, I think I know what it might be. It also says that there's a recent stomach flu outbreak. Stomach flu, acute gastroenteritis can be usually viral in these settings. So I'm already kind of putting those pieces together. When I look at his vital signs, I see a little low-grade temp, and otherwise he looks okay for a 3-year-old vital signs wise. So let's look through these answers. Well, Giardia, they didn't mention any type of exposure to certain kinds of water. They don't describe a greasy stool. So I'm going to go ahead and cross that one out. Same thing with E-Tech. I don't see any signs of traveler's diarrhea in this vignette. Now we have two viruses. We said stomach flu is usually an outbreak of a viral infection. These are both viruses and they're both very common. Now this kiddo is 3 years old and they also describe the stool as this greenish coloration. And when we see that, it's usually pretty indicative of rotavirus. Okay, rotavirus. A lot of these kids, it's very prevalent. I see it a lot. There are some vaccines against it, but no vaccine is ever 100%. So we do see this out and we see it a lot passing from one kiddo to the other in the daycare or school setting. All right, case 12, we have a 30-year-old man, bloating, flatulence, diarrhea, symptoms specifically after eating dairy products. It's like, well, wait a minute. Dairy products like dairy products that were left out, dairy products in general, I'm not really sure. Didn't really give us a good onset. So it didn't say like yesterday or the day before or anything. Well, let's keep reading. So no weight loss, no blood in the stool, vital signs look pretty typical, and a hydrogen breath test is positive. So one of their astute clinicians that saw them in the clinic thought to order this hydrogen breath test. And so you need to know that hydrogen breath test is related to lactose intolerance. So lactose intolerance, you don't always have to have the hydrogen breath test to make the diagnosis. Really just paying attention to the patient's diet. What are the types of foods or drinks that precipitate the type of diarrhea that they're having, or the bloating, or the gassiness. And in this case, we also have an Asian male, and we know that Asian population is more often affected, although it can affect anyone. I have some lactose intolerance myself. So unlike these other things like ulcerative colitis, Crohn's disease, they don't cause problems with blood in the stool. And then IBS is more of a generalized diarrhea and bloating and abdominal pain, and not so targeted to these specific types of food. And with IBS, you shouldn't see a hydrogen breath test positive. All right, 5 more cases. We have a 22-year-old male, intermittent diarrhea, abdominal pain, and occasional blood in the stool. He reports a recent weight loss and fatigue. Okay. Intermittent diarrhea, abdominal pain, blood, occasional blood in stool. Okay. He's a smoker and no specific food triggers. So we look at vital signs. They don't look too bad. We do a perianal exam. Sure, we did a bunch of other exams, but this one is specific. They're pointing out some skin tags in the perianal area. So it looks kind of vague. Like, I'm not 100% sure on this one, but he's young. It seems like it's been a problem for some time now. It's not a specific acute one. And now that I look at my answer choices, I'm trying to differentiate between them. So the fact that they said no food triggers, I'm going to cross out celiac and I'm going to cross out lactose intolerance. I know in the real world it's not quite that simple, but in a vignette world, they're going to tell you what you need to know. IBS. Should we have blood in the stool with IBS? No, we shouldn't. I mean, occasionally you can have it like from a flare of a hemorrhoid or something, but if they're putting this in the vignette, I'm thinking this could potentially be Crohn's. And just to take it a step further, what would we see if we did a colonoscopy on a Crohn's patient? Well, most of the time, the area that's affected is going to be that terminal ileum area. So sometimes with a colonoscopy, we can actually peek through and see that inflammation in the area. Although we know that Crohn's disease can be from the mouth all the way to the anus, which is why in this case, we probably see some of this perianal skin tags, because sometimes you can have some problems with fistulization or other things that could be happening because it is the disease can travel through all the layers of the bowel, causing extra intestinal manifestations. All right, case 14, we have a 25-year-old female, persistent bloody diarrhea and abdominal cramping. Urgency, frequent bowel movements, and no specific weight loss. We look at her vital signs, and they look all right. Colonoscopy, so she had a colonoscopy, shows diffuse mucosal inflammation from the rectum up through the descending colon. So it is continuous. It's in a continuous pattern. So if we have, this is our cecum, here's our colon. Okay, I'm not a medical illustrator here, but we're seeing disease that affects from the rectum all the way up this way, and it's continuous, meaning it doesn't like have a little here and then skip and have a little here like Crohn's would. So this is continuous pattern that is consistent with ulcerative colitis. Okay. Well, it looks like I didn't put ulcerative colitis as one of the answer choices here. So I definitely need to change that. I didn't proofread my answer choices. Well, let's just cross this out. UC. All right, this is definitely ulcerative colitis. IBS wouldn't have the bloody diarrhea. Crohn's is probably the only one that's even close to this. But then again, the colonoscopy would help you figure out that it isn't quite as sporadic as you would see with Crohn's disease. Okay. All right, case 15, we got just a few more to go. 33-year-old woman with a history of abdominal pain relieved by defecation. Very important here. Also associated with some bloating and alternating diarrhea and constipation. Now, symptoms seem to be chronic and worsen with stress. This is another thing that they've included in here that is it's deliberate, it's on purpose. Okay, no blood in the stool, no significant weight changes, vital signs are normal. I would venture to say that if any stool tests were done or colonoscopies were done, they would also be normal. So what do you think this is trying to show us? Right, if you said IBS, you are correct. IBS is, if you follow the Rome 4 criteria, has to do with abdominal pain and associated bowel changes that is relieved by defecation, and it's a diagnosis of exclusion. So make sure you don't blame it on IBS before you consider all the other things it could be. Case 16, 27-year-old chronic diarrhea. She also has some bloating and weight loss. Increased symptoms after eating certain foods. She didn't really say which ones. Maybe she hasn't quite put two and two together yet, but it does seem to be precipitated by that. She describes her diarrhea as kind of greasy. No blood, no fever, no blood in the stool. And family also has a history of some autoimmune disease. So, adding to it, we did some laboratory work, and it looks like her TTG IgA serology is positive. So that should be the clue in there to help confirm the diagnosis that you should have already been thinking of from the beginning. What do you think it is? Good. Well, if you said celiac disease, you're correct. So celiac disease is a sensitivity to gluten, right? Gluten found in wheats, rye, barley products. And we know that they can present many different ways, often times in younger folks, so kiddos and teenagers, presenting with this vague symptoms of diarrhea, bloating, sometimes some constipation, weight loss, failure to thrive, and shouldn't be bloody in the stool, and is precipitated by eating those foods that they are sensitive to. We can do serology testing, and then the confirmatory test is going to be a small bowel biopsy. And the small bowel biopsy is going to show villus atrophy. All right, continue on. Last case. We're almost there. Keep going. We have a 22-year-old college student presenting with acute onset of vomiting and watery diarrhea. She attended a dorm room gathering a couple days ago. So they're mentioning this on purpose. Sounds like some close quarters to me. No fever, no blood in the stool, mildly dehydrated. So she's losing it out both ends, so getting a little bit dry. So you see a little bit of mild tachycardia here, otherwise looks normal there. So which one of these bugs did we mention is found often in like close quarter settings? Good. If you said norovirus, you are correct. It's one of the most common causes of the stomach flu, especially the kind that can be passed from one person to the next. It doesn't really present with a like really high fever, bloody diarrhea, nothing like that. It's going to be pretty mild, although I've had something similar to that, and it doesn't feel mild when you have it. But in comparison to some of these other pathogens we've just discussed, it tends to be more straightforward and tends to go away fairly quickly, usually within 24, 48, 72 hours. Okay. So we just covered a whole bunch of different pathogens in a really short period of time. I did include in this presentation some of our more common pathogens, the incubation period, signs and symptoms, how long the illness tends to last, what kind of foods are associated with, what labs we do in the treatment. I think for these type of infectious causes, you need to know these charts very well because it's going to be those little details that help you figure out one from the other. Now, in the real world, we can get by without maybe knowing some of this, only because we are going to get some stool studies, and those usually, like stool PCRs, are going to tell us exactly what the cause is or cultures. But in our vignettes, in our testing world, we need to know these incubation periods. We need to know what types of foods cause these type of illnesses, and then we need to know how to treat them. So this is some of the foodborne. Here's more. Here's some of the more viral causes here, and then we have some parasitic. So I included all of these here so that you would be able to access and kind of compare and contrast. And so that's it. We were able to go through several different cases. Hopefully, by going through these cases, helps you pick out some of those buzzwords and discrimination factors that you can find and identify when you're taking your test. I know that some of these examples were a little simplistic in nature. It was done like that on purpose. I really just want you to pick out those key factors. If you have any questions about anything that we discussed today, feel free to comment or ask your questions down below. And just keep doing practice questions. You'll see these sprinkled throughout the GI Q banks, sometimes infectious disease Q banks. And the more practice questions you do, the better you'll get at picking out those details. And then, consistent practice is not going to make perfect, because nobody's perfect, but it will help make your progress towards success in the classroom and when you get out and you practice in the real world. So thank you very much for watching this presentation, and we'll see you soon.